Inhalation is the standard method for administering respiratory medications. The advantage of inhaling medications is that there are fewer adverse reactions than from taking oral medications. The major limitation to inhaled delivery of medications is that good inhalation technique is necessary for the drug to reach the lungs. Good technique is tricky. Studies have shown that up to 80% of patients do not perform one or more steps correctly. Metered dose inhalers, or MDIs, and dry powdered inhalers have different optimal technique. Patients prescribed a medication by an MDI and a dry powder inhaler can easily become confused about correct technique. Similarly, some devices can be difficult to use properly in some situations. Also, device technique has been correlated to the level of asthma control. Therefore, healthcare professionals need to select the right device for each specific patient and make sure they can use each device correctly. This video will discuss information that healthcare providers need to know to assist patients to use metered dose inhalers correctly. Issues discussed will include the parts of the MDI device and the advantages of MDIs versus dry powder inhalers, correct inhaler technique for MDIs including the closed mouth technique, the technique differences for using a holding chamber, spacer, or a mask with an MDI, and correct technique for the Respimat inhaler device. Provide feedback after observing a patient's device technique. We will also review MDI issues that affect drug delivery to the lungs, explain the rationale for using a holding chamber or spacer, identify factors to consider when selecting a holding chamber for a specific patient or device to include on your formulary, and outline the maintenance and cleaning of these devices. First, let's briefly review the parts of an MDI. The canister contains the medication and protects it from moisture and contamination. The canister also contains excipients, surfactants, and the HFA propellant. The propellant is a hydrofluoroalkane, or HFA. It dissolves or suspends the drug and also disperses the drug into smaller particles. The propellant needs to be compatible with the specific drug, so not all inhalers use the same HFA. The metering valve or chamber measures the fixed amount of drug released with each actuation, hence the term metered dose inhaler. Only a relatively small amount of drug can be released per actuation, for example, about 50 micrograms. This is why 2 puffs is the usual dose from MDIs. The actuator releases the drug from the metering chamber and includes the nozzle for the drug plume. With release of the drug plume, the propellant evaporates and smaller particles are formed. The ideal size for respirable particles is about 3 to 5 microns. Larger particles will collide and deposit on the mouth and throat. Smaller particles will not settle in the lung but will be exhaled. The exact formulation and the MDI device design can affect the percentage of particles in the respirable range. So, not all MDIs containing the same drug may be interchangeable, for example, albuterol. This will be important to consider as generic inhalers become available. There are several advantages to MDIs over other respiratory delivery systems. The cost per dose to deliver drugs tends to be less with MDIs than with either dry powdered inhalers or nebulizers. Some MDIs contain up to 200 doses, which is more than many DPIs, so an MDI may need to be refilled less frequently. Unlike the dry powder inhalers, MDIs may not have a secondary expiration date after initially opening the package, so there may be less drug waste. MDIs require a slower inspiratory rate than dry powdered inhalers, so the correct inspiratory rate may be easier for young children, the frail, elderly, or those with severe lung disease. Quick relief, various controller drugs, and several drug combinations are available. Therefore, a patient taking multiple respiratory drugs could potentially use only an MDI to deliver all of them. With correct device technique, the percentage of drug delivered to the lung can be similar to nebulizers, about 15 to 20%. However, with some HFA formulations, drug delivery is much higher, more than 50% of the dose released. The doses in the MDI are self-contained. Unlike some of the dry powdered inhalers, loading of individual capsules for each dose is not required. This is helpful with patients who lack manual dexterity. Correct device technique is critical for adequate drug delivery. Studies now show that correct drug technique is correlated to asthma control. Each step of MDI technique is important to maximize drug delivery to the lung. Most metered dose inhalers will require priming before first use. Priming makes sure that a full dose of medicine is released with each actuation. If the inhaler has not been used for a while, the propellant can evaporate from the metering chamber. As a result, less than a full dose of medicine is released when the inhaler is next actuated. Frequency. Daily controller medicines taken once or twice daily usually will not need further priming, but quick relief inhalers, if used intermittently, may need to be reprimed periodically. An inhaler left idle for 2 days to 2 weeks may need to be reprimed. Both the time frame and number of compressions depends on the particular brand of device, so check the product-specific package insert. Technique. To make sure a full dose is in the metered chamber, the canister is depressed to release the remainder of the dose currently in the metered chamber. The next dose then flows into the metered chamber. 2 to 4 compressions may be necessary to fully prime or fill the metered chamber depending on the brand of inhaler. In general, to prime the inhaler, shake the MDI well for 4 to 5 seconds to mix the propellant and the medication. Then depress the canister to release the required number of sprays. Now the inhaler is ready for use.